Hi, my name is Jessica Morrison. I'm excited to present my doctoral capstone project. We're going to be exploring the effects of facilitated aerobic exercise and repetitive task training on motor recovery in subacute stroke. My capstone is research-based primarily, but it also has an advanced practice component because I was delivering the OT portion, repetitive task practice, or RTP, to participants. This was completed at the Cleveland Clinic Neurologic Institute as part of the iScore clinical trial. In addition to also working directly with participants and on research, I observed across multiple specialty areas. Some include the ALS clinic, spasticity clinic, NICU, cardiovascular ICU, hand therapy, lymphedema, and breast rehabilitation. These experiences broaden my understanding of how OT supports complex interdisciplinary care across populations. Stroke is a leading cause of long-term disability, and about 60% experience residual deficits that impact their independence and daily functioning. So the study targeted that and combined RTP with facilitated aerobic exercise, or FE, using a motor-assisted stationary bike. The bike was able to enable participants exceed their self-selected cadence, so in hopes of increasing exercise intensity. It's theorized that this will promote neuroplasticity through the release of neuroplastic biomarkers, which will improve motor learning and recovery, which will lead to increased independence. When we get into the case, for my deliverable, I developed a written case study following care guidelines. A little bit about the participant. He was a 39-year-old male. He had left-sided weakness and hemiparesis after an ischemic stroke. Over 12 weeks, he completed 24 sessions. This included 45 minutes of cycling to start, and then 30 minutes of RTP, which I delivered, and 15 minutes of lower extremity gait training. When we looked at the results, the standardized scores like Fugl-Meyer and Action Research Arm Test did not show meaningful clinical differences and showed minimal change overall. However, when observing him from baseline to end of treatment, functional gains were clear. For example, he regained full active range in his left arm and could complete complex tasks that he wasn't able to do prior to the study, like typing, self-care, and household chores. When we looked at his lower extremity outcome that was measured on a treadmill-based assessment called the Karen system, it actually decreased. So his gait velocity declined over the course of the 12 weeks. However, he really did functionally improve. He started the study with a rollator and then ended the study independently walking with no assistive device. So we're starting to see a pattern here that observations are revealing the functional impact of rehabilitation when the standardized assessments do not. So this really does highlight that real-world gains in participation, activity tolerance, and daily performance are meaningful to the participant when the assessments are not showing that. For the cycling data, he was prescribed a 60 to 80% range of his heart rate reserve, which he was sub-threshold when averaged across all sessions. He averaged about 47%. Interestingly, though, his endurance in VO2 increased 12%. So this indicates better cardiovascular fitness and better endurance for him to complete ADLs. This case really shows how occupational therapy can capture functional gains that standardized assessments might miss, like increased independence. So relying solely on formal measures overlooks real-life progress. Also, the participant was undergoing a divorce, and this can highlight how psychosocial stress can impact motivation, leading to potentially the neuroplastic potential that we were trying to elicit through the cycling. However, OT's role is crucial in adapting treatment to address these emotional factors. In summary, this capstone really showed that combining the exercise with the RTP can improve motor recovery and increase independence, even when standardized outcomes are unclear. It reinforced the importance of client-centered care, intensity monitoring, and using meaningful activities, which are core principles of occupational therapy.